Welcome to today's Way Forward workshop, Leader Lunch Break, where we are thrilled to welcome Dana Langford. It was 14 years ago this month that Dana Langford was certified as a nurse practitioner following training at The Ohio State University. While the certification opened the window to the career of her dreams, it also shed bright light on the racial disparities in maternal and infant health. As she worked and witnessed firsthand the difference in treatment, she channeled her abundant energies into advocating to address the crises confronting women of color and their children. She realized it would take boots on the ground and in the neighborhoods and not just large institutions to make change. She wasn't sure if she could leave her position in a local hospital to create a health clinic for women to meet the specific needs of Black women and their families. Then she went to Ghana and she heard the call to be courageous. So in the summer of 2019, with colleague Tanisha Gaines, she embraced her conviction, summoned her courage, found an empty storefront, and opened the Village of Healing. Today, as medical director, she offers health and hope within the Village of Healing. Her efforts are recognized and applauded, most recently this past weekend, as she served on a panel at the Ohio Women's Leadership Conference hosted by Senator Sherrod Brown and Connie Schultz. Danae, thank you for joining us today.
I was so floored by the introduction, I forgot how to unmute on Zoom. Thank you so much, Marianne. I might have to travel with you from introductions for now. That was beautiful. Thank you all so much for joining me today for this opportunity to share with you Village of Healing, our services, and what we offer for Black women and children in this community. So I'm going to go ahead and get started because I know we're limited on time. All right, so is my screen up? Everyone can see the screen? Okay, good. All right, so Village of Healing, as Marianne said, was co-founded by myself and Tanisha Gaines. I have the pleasure and privilege of being a certified nurse midwife here at the center, but also serving as the CEO and medical director. My co-founder, Tanisha Gaines, is director of operations. So our mission at Village of Healing is a community development organization with a new approach to community wellness. By focusing on healing and empowering the individuals in the village, we will work to eliminate social determinants of health and decrease health disparities through implementing community programming, advocacy, and collaboration. Our vision for Village of Healing is to offer all members of the community life-empowering skills through multiple sources and mediums that will work to turn, heal, and empower the village. We will work to ensure health that leads to not only surviving, but thriving. Village of Healing is a large umbrella that encompasses programming and our medical center. We started Village of Healing in 2019 when myself and Tanisha were asked to sit on multiple committees about infant and maternal mortality, specifically in the Black community. While sitting on these committees, we felt like our voices were not heard. We felt like other Black organizations that were coming before these committees with answers and solutions were not being heard as well, or were being told we needed 5 to 7 years more of data before we could implement some strategies that we saw that were working. Myself and Tanisha knew that we didn't have 5 to 7 years. Myself being of reproductive age, Tanisha had just had a baby and said that she was waking up every single night to go check to make sure that her baby was breathing. And so from that point, I knew I didn't want to walk out of that door and tell my friends that were making decisions to not have children anymore, that we needed 5 to 7 more years of data before we could actually implement a solution. So we stepped away because we wanted to be able to make a difference in our community and be a solution. And we started Village of Healing, which again is that overarching umbrella. We started originally with programming. We had 3 programs: our mother-to-mother mentorship program that we do in collaboration with the RISE program out of Columbus, Ohio. We take Black moms that are currently going through maternal mental health complications, pair them with Black moms that are in recovery from maternal mental health complications, and it's a peer-to-peer support. They decide what that looks like. The goal is to decrease the stigma around mental health in the Black community and to get them connected with mental health counseling and services. Again, they decide what that looks like, and we're very, very loose with the term maternal mental health complication. What we know is that Black women are more likely to go undiagnosed or underdiagnosed when it comes to mental health complications and mental health diagnoses. About 30% originally before COVID were saying that they were undiagnosed or ignored. After COVID, some studies have said up to 80% of Black women said that they weren't heard when they reached out for mental health services. We also started our Black professional women's group in 2020. It was right around the time where we were watching the racial uprising, quote unquote, happening on TV every single day after the George Floyd, Breonna Taylor, and Ahmaud Arbery killings and murders. And so what we noticed is that we were a lot of times being forced to walk into predominantly white environments as Black professional women and to keep quiet because we couldn't discuss our feelings. We couldn't discuss what we were experiencing, what was happening in our homes, how we were feeling without it being misconstrued as being angry or aggressive. And so we wanted to provide a safe space for professional Black women to dissect the intersectionality of being Black professional and a woman. Also, in the conversation of infant and maternal mortality, we were noticing that there was a lot of victim blaming and conversations around poor Black women. And what we know is that socioeconomic status is not a protector when it comes to infant and maternal mortality. And actually, if you are over 30 with at least a bachelor's degree, you're actually 6 times more likely to die due to maternal complications than a white woman with less than a high school diploma. And so again, we wanted to be able to give voice to these professional Black women. And so our group encompasses professional Black women over 30 with at least a bachelor's degree. We do a sister circle twice a month. We bring in a mental health therapist and we dissect that intersectionality. One of those sessions is called our Queen's Night Out, where we also choose to support a Black business, have them come in, offer their products, we network with each other, and then we go into our sister circle after that. We're also a member of the Better Health Pathways Hub program, where we have community health workers that work with underserved clients and low socioeconomic status clients to work up pathways of their needs to achieve certain goals. In 2022, we opened our Village of Healing Center. We chose to focus on the healthcare center after the study that came out that said that Cleveland, Ohio was the worst place to live if you were a Black woman, and that included second to last in healthcare outcomes. And what we also noticed in those studies were that they talked a lot about culturally sensitive care, and that when you walk into a room and your provider looks like you, your disparities decrease, your outcomes are better, your satisfaction with your care is better as well. And so we decided to actually put that data to use as we were being encouraged in other groups. And we started the Village of Healing Center. We opened our doors in 2022, February 14th. We have now, at the end of our fiscal year on June 30th, serviced over 450 patients, over 1,800 visits. We've had over 21 deliveries. 2 of those were preterm, giving us a preterm birth rate of only 9.5%, which is under the goal of what First Year Cleveland has recommended. So again, we're showing those outcomes as well. Our vision is to offer all members of the community healthcare that looks like them. We work to ensure health that leads to not only from surviving to thriving. All of our providers are Black providers. Myself, we have a women's health nurse practitioner, and we also have a licensed professional counselor. We are expanding our services in 2024. Again, we heard the needs of the community. So we're going to be adding primary care, pediatrics, more women's health, and more mental health to the Buckeye Shaker neighborhood. We're also going to be introducing the first and only model in Ohio that includes our PEDS postpartum model, where you'll be able to attend all of your pediatric first year appointments with the newborn, with mom together. So those appointments will be together. So gone are the days of taking off of work to go to this appointment on this side of town, another appointment on this side of town. But both of you will have your appointments together in the same location at the same time. A team-based approach with the family nurse practitioner, the midwife, and if we need to incorporate mental health, we'll meet once a month to discuss these patients and make sure that they're getting all of the services and care that they need. So why was there a need for the Village of Healing Center? Number one and foremost, we want to recognize that racism leads to the racial disparities that we see in healthcare and the increased morbidity and mortality rates that we see amongst Black women and babies. We also recognizing the evidence that supports that Black patients feel harmed and unheard in these systems, making it even more difficult to advocate for themselves in traditional hospital systems. And we're also wanted to choose to address ongoing efforts to improve quality and access to care for Black women. Again, with that recent study saying that Cleveland, Ohio was the second to last in healthcare outcomes in a city where we have world-renowned healthcare in our backyards, and Black women were still very much feeling unheard. The services that we offer include obstetrics and gynecological care, prenatal care, postpartum, centering pregnancy, which is our group prenatal care model, lactation consultation, and preconception counseling. Under gynecology, family planning, well woman exams, pelvic exams, STD screenings, menstrual disorders, adolescent gynecology, and menopause evaluation. We've also recently added an OBGYN, Dr. Lauren Bouchard, who we are contracting from Cleveland Clinic, which is an amazing addition, because now originally we had to refer patients back into these systems where they were saying they were being harmed. Now Lauren comes to our office at least 2 days a month, and she's able to see the patients in the offices, and if needed surgery or other services that we can't do in the center, at least they know Lauren and they're walking back into the system with a Black provider as an OBGYN for their services. Our mental health services as well that we offer women and men over the age of 18 years old. If you are pregnant, we take you at any age. She does individual. She will be starting some group counseling as well, maternal depression counseling, relationship work, teen parenting, perinatal mood disorder, and grief and loss. We added Yolanda in July of last year. She doubled a normal caseload by October. So we had to shut down her caseload at that time. Since then, we've been able to reopen it, but thanks to Mount Sinai and a grant opportunity for them, we're adding a psychiatric nurse practitioner as well. And that's going to be starting in the first week of November. So again, we hear the needs of our community and we're able to act and be the solution. So just some contact information about Village of Healing and the Village of Healing Center. We're easily reached by phone, email, any of those contacts. And so I think I stayed up under my 15 minutes. I hope I did. And we'll open the floor for questions.
Dana, thank you so much. So how does someone access your services, and how are you spreading the word to raise awareness of what you offer?
So our services are easily accessible. You just call our phone number, 216-815-HEAL, 815-4325. We are spreading the word. We recently added a director of PR and marketing. And so we are at community events all the times with community tables. Our next big one, I think, is the Metro Health Multicultural Women's Festival or Fair. But we are always there. We also have some radio commercials I have yet to hear, but I always get phone calls about, we heard you on the radio. So we have radio commercials on 93.1 and 107.9. We also have billboards, and we also have some television commercials, if you have Spectrum Cable, that appear on different channels as well. Social media, what we've done is invested in a campaign to really get the word out there. We do understand, unfortunately, that we're in a competition with 3 large hospital systems. So we're having to do a lot of work to get the word out, and to also change the perception in Cleveland that you have to attend one of the large healthcare systems to receive care. Especially for Black women, it has not served us justice. And it has been harmful for us. And so what we are saying is we work with those 3 hospital systems very closely, but you can come to an outside system to receive great care.
You mentioned receiving some grant funding to help expand your services. What kind of overall is your funding model?
So right now we also accept all insurances. The only insurances we don't accept are United Healthcare and Aetna. And that's just simply because they've closed their market to new providers. But we take all private insurances, we take all public insurances. We also offer a self-pay option for patients that don't have insurance, or some of my patients from Aetna or United Healthcare are choosing to just be self-pay because we don't accept their insurance. And then we also offer a membership model. And those are for my patients that require more than 2 visits a month. Typically, that's my teenagers that are coming in, and I love it for every little thing. And so we are grateful for them. And so what we wanted to do was to be able to offer them an option as well, because a lot of times they don't want to use their insurance because it tells their parent. And as well as my heavy bleeders, my painful period patients, that we're trying to figure out plans that work for them that aren't opting for surgery. Right now, we are probably a majority grant funded because we're in our first year. So we're at about 95% or so grant funding, 2 to 3% in private donors as well. And so we're also sitting down to create another model to explore more of the private donor model.
You mentioned working in partnership in collaboration with the big health systems, but who are your other community partners and what additional partnerships are you seeking?
Okay, so one of our big community partners is Birthing Beautiful Communities. For those that are unaware, they are a doula organization that also works with pregnant women. About 99% of our patients have a doula from Birthing Beautiful Communities. We absolutely encourage it and strongly encourage it when patients enter the door. Our partnership with them is so clear and so evident as a method that works. We've recently received $1.5 million between the two of us from Creating Healthier Communities to show that the model of a Black midwife and a Black doula should be the national model utilized to decrease these health disparities among Black moms and infants. We also work with Neighborhood Leadership Institute very closely. And yes, we're always looking for partnerships, but we are very clear that partnerships are a two-way street. And so we are definitely having meetings to sit down with other partners to see how we can benefit them and how they can benefit us as well.
So you entered this work to address maternal and infant health. What has emerged as some of the greatest needs, and did you have any surprises along the way?
So as far as maternal and infant health, I think the greatest need that emerged that was very surprising to me, because I have been practicing for over 14 years, and I have been blessed with the opportunity to practice in mostly in all majority Black communities, is mental health. I think, working for predominantly white institutions, patients are still leery, even though when they walk into the office, they see me and they see someone that looks like them. They're still afraid to say, I need mental health support. And since we've opened our doors, our center is very intentional. Our walls are colorful. We have a Black art gallery with local Black artists. Each room is named after a Black person in history. So each room comes with a history lesson. There are statistics throughout each exam room. Our exam rooms are colorful all the way down to a red exam table and red gowns. You will see patients posting selfies all the time on social media in their gowns because they are so excited that there are colorful gowns and rooms. But I think that this intentionality has allowed Black women to come into a space and feel safe. And so they are seeking a lot of mental health care. They are saying, I need support, and they are agreeing to medications as well. So I think that's been a huge surprise. And another big, huge surprise is, I always say Black women are the CEOs of our families. So busy, a lot of times we're taking care of everyone else in the family that we're letting ourselves go, or we're not looking out for ourselves and in control of our own health. And so the primary care that I've had to do with my patients has been, I could never even imagine. And so what is also happening is, again, that was a need that we saw. And so we heard the need, and that's why we're adding a family nurse practitioner as well.
So starting something new is such a risk, and there's so many have a challenge with embracing that risk. How did you take the steps to launch Village of Healing and really lean in to the risk involved?
So first and foremost, I am a spiritual woman. And so I depended on God, and I continue to depend on God as I did a long prayer last night. Every day is a fight. And I was talking to a friend of mine yesterday who has her own business, and it's an LLC versus a nonprofit. And I told her I feel like as a nonprofit, every single day I'm worried about the months to come and trying to make sure that I have the budget and the funding to be able to continue to operate. And she said to me, girl, that happens at LLC too. Every single day I'm worried about the next day. And so I think, number one, first and foremost, is my relationship with God and having faith and trusting Him and walking out. Also, having a partner has been tremendous for me. Some of you know Tanisha, she is the complete opposite of me. And so when I always say the yin to my yang. So when we get our nose and I am in the office yelling and screaming and saying, why, she is in the office like, this just wasn't for us. And the next one will be. And so we're just going to wait for this next one to happen. And so I think having her as a business partner and a friend through this has been tremendous as well. When we walked away, we knew that there was a calling that we were called to. We knew that if we stayed in the hospital systems, we were doing our community a disservice. And when we walked away, we were absolutely prepared to use our 401ks and our savings account to fund, to move forward. Clearly, by God's grace, I did not have to do that. And I also think that, unfortunately, but great for us, that racial uprising had a lot to do with us getting the funding and everything, because white organizations realized that they needed to support Black organizations, whether it was intentional or whether it was for show. Dollars followed with that racial uprising and with those murders, and with it coming out that Black organizations and racism very much still existed. And so we got a lot of support, I think, from white organizations that were saying, okay, obviously the hospital systems are not working for this, so let's try something new and something different. You've presented us with the data. And so they were able to support. Big shots out to St. Luke's Foundation, who gave us our first large grant of $75,000 before we even opened the door. And I attribute that again to having Black people at the table. So their CEO, Tim Tramble, their executive director, Tim Tramble, sitting at the table, I'm sure had so much to do with it, to say, hey, let's invest in this organization. And they continue to invest in us. As it was announced last month, $1 million grant was given to our organization.
Congratulations on that. That's amazing.
Thank you. Thank you.
So you opened your doors in 2019, and then here we have global pandemic. How did you innovate and survive that time to come out on the other side?
So originally when we opened, we were all online. So thank God for that. So 2019, we were all online. I think that a lot of our programming was online, and a lot of our programming was mental health. And so as a Black woman going through COVID, hearing about how I was more likely to die, my family members were more likely to die, and my community was more likely to die due to COVID. And then turning around to have to hear George Floyd, Breonna Taylor, Ahmaud Arbery, amongst others, it was a lot on us mentally. And so I think, us kicking off our mental health program was definitely helpful, and we were able to survive because of that. And like I said, it was all virtual. And then when we decided to open the doors, I think that we used COVID as the example to say something like this is needed and a space like this is needed. So even when we opened our doors, there was an uptick in COVID cases. So we made sure to have the masks and everything. But what I did notice is patients were way more excited and likely to walk into our doors than they did at my previous hospital systems, even with COVID going on. And we were able to meet them where they were. We were able to recognize their culturally sensitive needs and to be able to meet that. And so I think that all of those things helped us to be able to survive through COVID.
Do you envision expanding beyond your current physical space or opening in a different community?
Yes. And so, like I said, in 2024, we'll be launching our Buckeye Shaker neighborhood. About 40% of our population right now comes from that neighborhood. And so, again, there is a need. And so, we want to provide that access. And so, we'll be going over there. We're also in conversations with some other cities around Ohio who are super excited about this model as well. Eventually, my goal, ambitious as it is in the next 5 to 7 years, this should be a national model. The outcomes are showing that it works. We are showing that. And so we do bring in evaluation. We work with Cleveland State University, Dr. Heather Rice and Dr. Celeste Collins. Right now, they're evaluating this current center. In 2024, they're going to evaluate that PEDS postpartum model. And so what we want to show is that this is the answer and it is the solution. And I think it's going to show that it's the solution across racial disparities. Black women not only are suffering from maternal mortality, but also breast cancer. We're more likely to die and have the worst breast cancers. We see it in cervical cancer. We see it in heart disease. We see it in Black families with diabetes, high blood pressure, all of those things. And so what we want to show is that this is the answer and the solution. And then not only that, but we know, less than 5% of Black providers are Black, but less than 5% of providers are Black across the spectrum once you average it out. And so we want to go back into schools to figure out how do we create this pipeline for Black students to go into healthcare fields and careers so we can continue to be this pipeline and this motivation to continue to decrease these disparities.
As you think back over the past few years, what successes are you most proud of so far?
All of it. Somebody recently asked me, what is my definition of success? And I couldn't even answer because I haven't created one, because to me, I still don't feel like we're successful because there's so much more work to be done. But I think, being a Black woman or two Black women that walked away from predominantly large white institutions to start this practice speaks for itself as a success. To be able to raise the funding that we've had, over 1.5 million in our first year, that is a success. But I think I'm most proud that women leave here happy, that women leave here in tears. We've posted it on social media. Women leave here excited about their care, and women leave here feeling heard, and they feel like they've actually been treated, and they've actually received good, equitable healthcare that is going to impact their lives forever.
Are there organizations or avenues or places that you're looking to get better connected with to spread the word that those of us on the call can help you with? And in general, how can we help you and support your work?
So I think, networking is important. Networking is how we ended up here. And how we will continue to grow. So I'm not aware of all of the avenues that exist. And a lot of the conversations and partnerships we've developed have been from introductions. And so if you know of an organization that you are like, they would be perfect to work with Village of Healing or provide funding for Village of Healing or connect them to resources, please email, phone call, whatever. We are open at all times to meet with everyone. And so I think, the biggest avenue is that networking conversation. It's how we've been able to get into doors at Cleveland Clinic and Metro and UH, how we've been able to sit at the tables that we sit there now, because of the networking and the introductions that have happened. And so I think that is probably the most important way. If you know an organization or a person that I should be meeting with, please do not hesitate to reach out.
Well, Dana, I thank you for joining us today. And I think all of us are very thankful that you and your partner did not wait the 5 to 7 years to get started.
Thank you. Thank you so much. I really appreciate it.
Dana, we're not only grateful for your time today, but for the amazing impact that in a few short years and through a pandemic you are having in the community. And we are behind you, and we'll answer your call to help you network in any way possible.
Thank you so much, Marian. I really appreciate it.